Welcome, everyone, and thank you, Yardi, for sponsoring today's Leadership Huddle. Today's NIC Leadership Huddle, Trends Shaping Senior Living Post-Pandemic, is the 9th Leadership Huddle of our 2021 webinar series. I'm Chuck Harry, NIC's Chief Operating Officer, and I have just one quick comment regarding the webinar's logistics ahead of our panel's discussion. If you need to adjust your audio for today's webinar, you have joined the webinar using either your computer speaker system or your phone based on your audio access during your most recent GoToWebinar session. You can adjust your audio access to today's webinar through either your computer speakers or your phone using the settings in the audio pane, which is located on the top of the control panel on the right side of your browser window. Moving to today's panel discussion, it's my pleasure to introduce the co-hosts for today's Leadership Huddle. Maria Nadelstumph is the Senior Vice President of the Brandywine Center of Excellence for Brandywine Living, where she leads a company-wide program in business unit designed to increase workforce development and retention, leadership training and engagement, quality assurance, and service line innovation throughout the company's 32 community portfolio across 7 states. Joe Kiernan serves as Chief Strategy Officer and Senior Vice President of Network Development for Ocean Healthcare, a network of post-acute healthcare facilities and service lines throughout New Jersey. Joe is responsible for the company's strategic direction, ACO relationship development and management, preferred provider network development, BPC initiatives, and other shared saving relationships and management. Maria and Joe, over to you for the panel discussion on trends shaping senior living.
Thank you, Chuck, and welcome and good afternoon, everybody. We're excited to be here, and it's a pleasure to work with my colleague Maria on our discussion today. We'd like to welcome everybody, and especially to our panelists and our colleague Fee Stubblefield, who is the founder and CEO of the Springs Living, which operates 13 senior living communities in Oregon and 5 in Montana, offering a combination of housing options, including independent living, assisted living, and memory care. So welcome, Fee. Is there anything else you'd like to tell us about the Springs Living?
Thanks, Joe. Thanks, Maria. Great to be here with you. You know, I think after the last 12 months, I think it's pretty important that we recognize too the statistic that's really important is that we get to work with 1,800 amazing, caring professionals that saved a lot of lives this year. So we're based here in Oregon and happy to be on with you today.
Well, excellent. Well, we really appreciate it. So for today, we will be discussing trends that shape senior living as a result of the pandemic, looking at both a future trends and also what we've learned both in the short term and the long term as we've all traveled through this challenging time, and identifying the best practices to help operators and their capital providers stay ahead of the curve, including what we've learned from the pandemic and what the pandemic has done in terms of accelerating programs that integrate a healthcare component into a senior housing environment. So we have 3 primary areas. Maria, why don't you take us through our 3 areas that we're going to focus on today?
Perfect. Fee, again, welcome from the West Coast, East Coast here, broadcasting live from New Jersey. So just to make sure that everyone knows that Joe and I both are social and safe and both vaccinated. So it was nice to be able to join forces here today. We're super excited because as we are all as operators, we are in the recovery mode. We are regaining momentum in occupancy and just normalization with operations. So kind of looking at some of these trends of how this impacts the industry going forward, what should we be talking about? So there's a lot of trends, and what we talked about, Joe and Fee, we talked about kind of bucketing these into 3 different areas of healthcare, of housing, and the business. And the healthcare side, we've seen trends in everything from an increase in clinical capabilities and care partners. We've seen on-site access to health services coming into the community, different strategies for and practices for infection control and mitigation and containment. Under the housing side, we're past the real estate. We're talking more lifestyle. So we've seen definitely a huge focus on well-being and wellness and lifestyle. We've seen a focus on the growing use of technology and the change in environment, just what's happening under the roof. Like, what are the spaces that we're using and how are we living life differently now? And under the business side, of course, it's occupancy and, what are some of the trends that we've seen with the digital, sales and marketing, the use of the digital platform. We've seen also a change in a trend with the workforce. I think that's probably its own huddle, but retaining and recruiting quality staff. And the big piece on the regulatory environment, leaning into that and having a place at that table and understanding this new environment that we're in from regulations. So lots to talk about. I think we want to tap in a couple of these different buckets and see where our dialogue takes us. And I think ultimately at the end we want to walk away with some, not just lessons learned, but what are some practical tips for the future?
Exactly. Some solid takeaways that our audience today can really learn from. Go back to the office tomorrow, have those conversations with their teams, hear what innovators like yourself have really taken on during this process. So with that being said, I'd love to jump right into the healthcare component. Clearly, senior housing, when it was back when we started talking about assisted livings and independent livings, it was much more about that lifestyle. It was not really healthcare. Healthcare was considered the skilled nursing side, the post-acute environment. Clearly, healthcare is a huge component of what we do for seniors housing. It has to be a component of it. So throughout this process and taking a look at a new healthcare approach, what changes did you have to make from the pandemic perspective? And have you changed anything moving forward that you're going to keep in place, having learned from that process?
Yeah, great question. I think, it's interesting. When we used to hire people and we used to try to explain to them we're community-based care. So we would call that, assisted living, memory care, independent living. On one side, and this line right in the middle was kind of where you cross over into the healthcare side of the world, right? Which that's not us, community-based care, right? That was, that's skilled nursing and hospitals, doctors, and the whole healthcare system. And I know for much of our 25 years, it's like we don't really want to know what's on that other side of the line because this is our side of the line. This is community-based care side of the line. I think COVID, the last 12 months have changed that, and now that's a big parent over the whole thing, meaning that we are all been thrown in this together because we've had to all be part of the solution, right? We had to evolve in areas like, just environmental infection control, how we look at our environments, how we deal with our workforce, how we communicate. There's been many things. I think the environmental systems are definitely here to stay. We're very thankful, and we've talked about this on previous Nick discussions, just about a local company that helped us test the environment and predict outbreaks before they happened. That saved a lot of lives, and Virotech did a great job, and I think they're here to stay. That's going to be part of our future.
Excellent. So, Fee, what did you focus on with regard to clinical capabilities? And have you changed that? Did that change from your model pre-pandemic? And then what did that look like from a clinical capabilities perspective during the pandemic? And where do you sit now?
Well, we've seen this direction. Housing and healthcare have been heading toward a fork in the road where they're going to join up, right? And the last 12 months have kind of accelerated that because we've had to do that. So we've been doing, I don't know how long ago it was quite a few years ago, we opened our first telehealth clinic in one of our communities where we gave access to not only residents, but also staff on a subscription basis. It went over really well, but it was just kind of a learning experience. In our newer communities, we've actually put in and worked with different, we work with a local concierge healthcare provider and have clinic and docs in the buildings. right? I think as we build communities where people want to live,
Mhm.
that the healthcare has got to be part of that. I think, we talk about every time a new resident moves in, we have to evolve because that's a younger generation that's moving in. And what we did last year or 10 years or 20 years ago, this is a completely different person that has completely different expectations. And in the past, I think a lot of our residents, our customers were okay with spending all day in a doctor's office, right? And going from place to place to place. I think the future market, what we see is they're not. That's healthcare support's got to be latent. There's got to be a continual merging of those support services that are latent in that community. So when a resident needs to access it, they can do it in the pace of their life and the quality of their life that they're experiencing in our communities. They're not having to, to spend all day in for routine things, certainly, in a more of a medical model or a hospital. And I think the hospitals, with the capacity issues, it's so expensive to deliver that care. I mean, older adults spend a large majority of their time in healthcare later in life, and so we've got to find a way in our communities to take some pressure off that healthcare system. And I think you're seeing that through some of the Med Advantage plans. I think you're seeing that through some of the innovations that are happening. We're in discussions around that. You've got I-SNPs and C-SNPs, and you've got concierge healthcare, and all of it's coming together. So I think it's here to stay. There's no doubt about it.
Yeah, exactly. I think, we certainly learned a lot from it. We've follow a very similar model. I know, Brandywine sort of innovated this years ago with the on-site nurse around the clock 24/7 in the assisted living environment, where that really wasn't the norm. Everybody followed suit. Our assisted living communities, we do the same at this point. And, that was a major component for us when we were really having to deal with significant healthcare issues for our residents, and then bringing the physicians in. And you mentioned the use of telehealth. We did that. That was a significant model for us, and really helped for physicians who were concerned about coming into, a COVID environment, or not wanting to expose our residents and our staff. But utilizing telehealth was a significant component of how we managed our patient population. And that's something that we're going to continue to use moving forward. Wondering if you had any thoughts on that.
I do. I do. I think Fia said it well too, that, the trend was already out there in the healthcare infrastructure, having some type of healthcare within our communities. But not so in your face, right? So we've talked a lot about at past NIC conferences is how do you start weaving some of this healthcare and this services and support services in a building. And definitely the pandemic has accelerated that right up out of the gate here. So people are now really focused on what can we bring in, what support services can we bring in, layer in, without compromising that social environment. And that's kind of a key thing too in our space, is that we want healthcare. And we have licensed nurses and we have clinical capabilities in our buildings, but we don't want it to be in your face. It's there when you need it. And I think that's also, incredibly important that as we go forward, is that putting in healthcare layers of some type of support service, whether it's the telehealth or it's the on-site clinics or physicians coming in-house or therapy, whatever it might be, there's a way to do both to make sure that it's a right marriage. And I think what we've learned a lot in this pandemic too is the partner side. And I know that's a really key piece of people that are tapping into these partners. Who are they? What do they look like? And are they part of your team, or are they more of a vendor? And I think we've learned a lot in the pandemic is that you really rely on those support services and those partners coming in. And those partners probably in the future need to be redefined a bit, really making sure you're fully aligned in terms of your standards of practice, and they're part of your team versus someone that's coming in very transactional. That doesn't help the care process and the continuum either. You've seen that.
Yeah, you make a really good point about that. It's, I remember when we opened our first community opened the doors in 1998, and we had a 40-hour-a-week consultant, right? That was the extent of the healthcare. And so it's evolved now to the things that you guys are doing, Brandywine, and and most operators out there. But I think if we're going to have partners like you talk about in the healthcare, if we're going to merge this together as operators, we have to evolve and we have to invest in the infrastructure, because we're going to have to prove the health outcomes for these residents. And the delicate dance is that while we have to become more integrated with the healthcare system, we don't want to be the next nursing home. And we all talk about this all the time. It's a model that has evolved, that assisted living and independent and memory care, seniors housing, has really evolved out of the need for what the customer wants. But we have to also, behind the scenes, be able to prove the impact of the environments that we create for residents and the benefit to the healthcare community, and do it in a way that the customer wants to be there. Not that they have to be there because this insurance payment necessarily says you have to be here. Well, that's coming too, but they want to be there. And so that's the challenge. So we got to get better with data. We got to get better with technology. We've got to invest more into infrastructure systems. I'd contend that has to connect with environmental information, just not personal health information from our residents and the outcomes itself, but also information on the environment. And we've got to do that not just for our residents too, but if you think of our staff and the demographic makeup of our staff, they have a healthcare need. They're working, 1, 2 jobs, entry level, and how do they have time to get the healthcare access that they need? So I think there's some really opportunities for us not to just impact the healthcare system, the cost drivers, the quality for our residents, but also for our employees.
That's a great point.
Excellent. That's great.
I love that point.
So Maria, why don't we jump into our housing bucket, so to speak? So we've had our, healthcare has its place definitely in that environment. And then also our healthcare partners. I think we've all recognized the importance of that. Why don't you take us into the housing and the environment that we work in and that our customers live in?
Absolutely. I think this all ties together too, Fig. You mentioned a few different things. And by the way, congratulations. I know you are opening a new building in Washington State. Is it
two properties, right?
One I just saw with the waterfront. Is
we just announced a new community on the Columbia River, which is just going to be spectacular, epic views in the Pacific Northwest, and it's really kind of a next generation for us. We're very excited about this community. We're also broke ground in February on a community in Happy Valley, Oregon, here in the Portland metropolitan area that we're really, really excited about, and it'll be opening about this time next year. So. A couple things. Life still goes on. I wasn't sure a year ago if we'd ever be building a building for a community again, but here we go. We're rolling forward. So,
well, I think that's a perfect example of what our audience is listening to and hearing.
Yeah.
I think so much of we need to hear these operator stories. Our capital partners, they want to hear this. They want to know that there's a place for the money to go and that there's going to be a return, and that we are kind of really looking forward. So congratulations to you for really taking that step. And I know a lot of folks have done it even during the pandemic. Congratulations to those operators and owners and the capital providers that believed in their vision. So excellent, very nice.
Well, I think your building, and I think, as Brandywine too, we opened a community, during this pandemic as well. But really looking at the lifestyle of a real estate side. And I think this is kind of what we come back to, that what we learned during this whole pandemic, we always knew lifestyle was a component of what we do, but wow, has it been really in our face more than ever, considering what the devastation of what the result of the pandemic and residents staying in their apartments and not being able to see their loved ones and not having families come in to visit. And wow, that took a toll on everybody involved. And we're so happy that we're kind of reopening and we're back to, getting back to some normalization, but it really focused us on lifestyle and what should we be thinking about? What should we be considering? You just developed you're opening a new building, and development, has some of these considerations even tied to that, so I'd love to hear your perspective on what the new lifestyle looks like and what should these operators and investors be thinking about?
Well, I think there are definitely technologies and things we learned around the environment, whether it's cleaning the air, detecting, threats that come in, because COVID-19 is not going to be the last biological threat that we have to protect people from, and really being able to get more sophisticated in our communities. And it's just not the building itself, that's a big part of it, but it's also the operating systems, how we prevent things. Our facts, so we have tracked, I mean, we're talking about data, and thank God that our team has been working towards this and been tracking data. So we've tracked basically move outs, the mortality rates, move outs due to death in our communities for the last several years. And even with COVID, in our circumstance, I know this isn't everywhere, but in our circumstance, that we've seen a decline in move outs in the last 12 months due to death. And I think a lot of it is we eliminated all those things that we really didn't see before, like the impact of norovirus. I mean, it changed our operating procedures. So while there are things in our buildings that we're doing around putting the air scrubbers and cleaners into our environment, we're changing our control systems on our elevators so that if we have outbreaks, if we have situations where we have to secure or parts of the community, we can do that more efficiently. And just it's seamless. But I think we have to get ready for the future where people can live. We can create environments here that people can continue to live well, even if there's a storm raging outside, right? I'm pretty sure at time in human history, people were living in caves and maybe lean-tos, and the big storm comes by, you kind of get wet and cold. And so we have evolved to these houses. I think it's going to be a little dramatic, but similar type of scenario in our communities. Is I think our communities will continue to evolve to allow people, no matter what's going on outside, if we have people that are more frail, healthcare, more sensitive, that we not only have the staff, but the environments. And there's organizations like one of the things we're doing in our new communities is we're working with Fitwell, right? And making sure that we create environments that are healthy from day one when people come in. So there's a lot of exciting stuff on the future around the communities themselves and where it goes. And we're going to have to, our environments that we create in the future are going to have to be, technology is going to continue to make things more optional for older adults finding support services. And we need that because the demographic waves that we have coming at us, we have to find multiple ways of meeting this need. And so what at the Springs Living, what we're trying to do is create environments where people want to move in, right? We talk about how this is a goal of ours is really to create an environment where people can't wait to get old enough to move in, right? It's like, remember when you go to Disneyland, when you're a kid, you can't wait to get there. I know that might sound a little extreme to some people, but that's the passion that our crew, our team looks at this, like, what can we do where it's like, not only for the residents, but for their families too. And so I think we're going to have, as a profession, as an industry, we're going to have to continue to do that and become more and more sophisticated and sensitive about that. Not places that people have to go, but people want to go.
Yeah, I think that's a great point. And, and what does that look like? So for operators out there that are, really trying to reposition themselves or rebrand themselves and really focus in on lifestyle, to your point, we want people to be knocking on the door and coming in, and it's not just about the building or the chandeliers or the wallpaper. It's really about vibrancy and life and fun and being able to have, I like the Disney analogy because, people will relate to that, but they'll also relate to just, I just want to have a cocktail in the pub, put my feet up, have a couple laughs with my girlfriends, and I'm 105 years old. You know what I mean? So, these are the kind of lifestyles that we want to create for people, and also get the word out of what that looks like too. The pandemic has also challenged us with some consumer confidence, and I think that's evolving a little bit now and changing a little bit now, where safety was like the big focus and still is. But lifestyle now is definitely topping that up here. And I think we need to spend extra attention on that and drive that home more. And if you don't have that offering or know what you offer, we need to do more on creating that opportunity and creating that Disney World kind of esque. In my case, I like the Epcot fee a little bit better, but it's okay. But I want to create more of an Epcot, right? You'll have me signed up for that too. So
I like that one better. That's a little
like
better.
Epcot better.
Yeah.
Although Splash Mountain could be fun.
Yep, that's true. That's true. I think we talked about the changing environment too a little bit when you talked about the use of technology and again, space-wise, you know, we've been really creative with how we utilize space a little differently. All the non-rentable spaces, we've all been super creative on how to get people out of their apartments, how to keep them safe, how to do things socially distanced, physically distanced. You know, what considerations should people be thinking of now in the development or even CapEx world on just outside of, I know you talked about the purifiers and other things related to the environment in the physical space. What are some things we should be considering?
Well, for us, you know, the first communities we built really with the 100% residents in mind, and we were really focused on that. But it didn't take us long to realize that really the quality that we're all looking for, the results that our customers and their families are looking for, it doesn't happen just with residents. It happens with that direct care staff and those residents, and that touch point and that connection. And so as we evolve as we build new buildings, as we evolve our older buildings, we're going to have to really pay attention to the space for our employees and our staff and create great environments to work in. I mean, you create a great environment to work in, and you influence the quality of the environment to live in. And there are little things that we can do. But look at some of our, you know, the buildings that we've all built. Gosh, our break rooms are the size of a housekeeping closet. And, you know, there's these industrial looking lockers, and there's we're going to have to think a little bit differently about that, because our workforce is key. So the buildings are going to have to evolve to continue to attract talent that want to work there and create an environment that's supportive to them. But they're also going to have to evolve in using technology and using other methods to create better, safer environments too. So that's what we see the future is. And you know, we've heard a lot about in-home care, and there's technologies for people to stay in their homes more. And you know, we've even heard questions like, is that a threat? It's like, no, it's not a threat. That's a really, really, really good thing, because there are times when we want to keep people in their homes as long as that's a quality of lifestyle to them. But if we can do that with trained professionals that can then help them transition, if they need another level of care, into communities where they can live better. I mean, that's the bottom line. We're not. What do we really do here? Do we rent apartments? We don't rent apartments. We provide service to people, right? We provide support, and so that's really the need that we have to focus our new communities. And not only that, but for the workforce, which we're all challenged with right now. We're all, you know, I don't know about you guys, but well, I could guess, Maria, that you, especially with what you do for Brandywine, you probably have some sleepless nights on how to continue to attract and keep, not just attract, but keep the workforce and can develop it, because it's a struggle out there right now.
Yeah, I think we're all experiencing that, especially now, with trying to get workers to come back to work, and have people want to be able to do this kind of work and find the value and the joy in it. And it is definitely challenging, seeing it not only in the seniors living space, but also for us being, you know, very well diversified with multiple service lines, not only, you know, skilled nursing, long-term care, post-acute rehab, assisted living, and hospice, as well as home care, behavioral health, and it goes on from there, where we have created, you know, really a network within particularly in the state of New Jersey, where we really are able to service not only other other operators, but ourselves. Mm-hmm. And one of the things that got us through was knowing that we did have a staffing license within our private duty home health company, which supported all of our buildings and supported our communities to be able to stay open and have the staffing that was in place. And now working really diligently to try to get them to come back to work and get and get up to the staffing levels that we need. So a major challenge and a lot to think about for the future, for sure.
And it's a segue into the question you were going to ask about recruitment and retention anyway.
Right.
So, I mean, I could tie into that since we're on the topic. You're right, Fee. Yes, we're up at night thinking about where we're going to find the next employee, the next care manager, the next nurse. And as we're competing with Walmart and McDonald's down the street, who's paying a couple dollars more, things have changed, right? So I think this is keeping everyone up at night right now as people are choosing to stay home because of these extended unemployment benefits and so forth and so on. So, it is a challenge. I think to Joe's point, having, an internal pool of people, I think is key. I think the other key thing that we need to think about is how do we attract people? And sometimes attracting people is really zoning in on the people that you work with now, who's in your buildings, that can be your best salesperson, that can help refer friends and family and try to get as many people in who really want to work in this industry and want to work with your company. And I think that's something that everyone needs to be, thinking about and considering is like, how are we attracting people in to kind of come work in a healthcare environment? I think we're lucky enough with the vaccine clinics and the vaccines out there that we've created a safer space, that people are thinking about safety. Is it safe to work in a senior living environment? Is it more rewarding? But the bottom line is wages pay. People are looking for money, but I think we need to kind of almost put a sense of urgency around this. And looking at our sales piece, and we'll talk about occupancy too, it's the same level of urgency. An applicant is basically your new sales lead. So if you're going to pick up the phone and call anybody who calls related to looking for mom or dad, we're doing the same type of urgency for anybody looking for a job. So, it's all hands on deck. The tour is the new interview, and, we have to wow people. We have to spend some dedicated time doing that and make people want to work for us. And we want the same for them to work with us. Is like a perfect marriage, but I think we're at a point where we're wooing people at this point.
Yeah, and I think it was an interesting dynamic that shifted. I think we've all heard, the term, thank you for your service. And it has always really been directed towards the men and women in our armed services and in the military. And or even to police officers, where we say, thank you for your service. The shift in looking at healthcare workers, not only just doctors and nurses, but our nursing assistants and everyone that's involved in healthcare that came to work every day and, put on all the PPE and worked those shifts and wore the masks. There's a new level of, I almost want to say, respect to a certain perspective, or a sense of recognition that these employees have, that it was different before. So when you see somebody say to a nurse or to a nursing assistant, thank you for what you do, thank you for your service, yes, they're getting paid, but it was getting paid during a pandemic versus what it was before. So I'm wondering, as an industry, are we stepping up and stepping forward and using that as a recruitment opportunity and a retention opportunity to say they're worth more, and there's a lot of value there, and how do we compete with kind of just the quote unquote everyday job? Because I don't think being a nursing assistant anymore, or an HHA or a CNA or a nurse, is an everyday job anymore. I think it really changed things.
Yeah, Joe, I think you said some really important things, and Maria, about we have to innovate on the recruiting side of it. But one of the things that we've noticed, and I think as we talk about changes to our environments and data and healthcare and all that, we also have to do the same, invest the same thing into our HR tools and our ability to understand our employees, because really in senior housing, that's what we are, right? That's our raw material, is our labor. And we're not builders of buildings and communities and real estate acquisition. We're an HR company. And we must become highly sophisticated in that. We were looking at this because we have the same thing going on. We need more people, we can't get enough people. But if you really look at it, we're hiring people, but our back door is too big.
Right.
Right? our back door is too big. So while we have to get better at bringing people in the front door, we've got to get better at closing the back door. And I think one of the silver linings for this solid economy, for the healthcare workers, the people that save people's lives, that were there, that we've all gotten emails, these heroes that are out there that absolutely have to be recognized, is this is their time. This is good for them, and the market must respond. And we must make sure that we're listening to them and not commoditizing our employees, but able to create environments where they can thrive and have their lives, so that one day when they get to be our residents' age, you know, they can live well and they can take care of their families and they can do those things. And so how do we've got a great puzzle here to figure out, and we will figure it out. And it's going to take not just entrepreneurial organizations, support of capital, but it's also going to take, I think that we've learned in the last 12 months, our public partners, right? Our regulatory partners, working not as adversarial, but in conjunctions. We've had our best outcome where we can come together and be solution oriented around not only policies around resident care and safety, but also around employment initiatives and finding ways. Listen, we're spending plenty of money between what our government spend, what we spend, but maybe we haven't allocated it exactly the right way to really listen to our employees. In fact, we might even be able to contend that if we look at our employees a little bit more like our customers, because they're the ones that take care of our residents, right? Those of us in management, we don't do that anymore. We're there on occasion, but we're not there 24/7, 365. So to that extent, I think this is a great time if you're starting out in a career that has great potential in senior living, and you're a young person and you want to get going and have a meaningful career, not where you can just take care of your family, but you can feel that you make a difference. And, as operators and owners, it's important for us to recognize and thank people and say, thank you for making a difference. But we also have to drive the resources to those employees that they need for their families too.
Right. Yeah, we follow a guideline that, do the right thing for the right reason and the money follows. And it's, especially in certain, really applies in certain, every aspect of our business, but especially when I look at some of our service lines, like on the hospice piece of it. There's so much that those employees bring to a person's life in a way that nobody else does, in probably one of the most kind of precious moments of their life. But definitely looking at how we treat those employees and how we're recruiting them is a huge component of it. So Fee, we've got a little bit time left to jump into our next bucket. So I'm gonna jump in, and we're gonna talk about the business side of this. So we've taken care of our residents, we've taken care of our staff. Our investors would like to see some ROI. Everybody would like to kind of come out of this and see what are we doing to continue to bring in the revenue. So there was a lot of disruption during this whole process. I think people were very hesitant to move into a congregate type of living setting. So we had lower number of inquiries, lower number of move-ins. Some companies even made decisions that they were not going to do any because they weren't going to expose their existing resident population to outside folks coming in and really putting time and money into trying to attract new customers. But we've got to keep the lights on. All those employees that we talk about, we wanted to keep them all employed. We didn't do layoffs. It was tough decisions, but we wanted to have our folks back when we knew the doors were going to open up again. One of the big disruptors that I know, at least, and we've got a national platform here, so we've got folks from all over the country. You're on the West Coast, we're on the East Coast, and everywhere in between. Regulatory oversight and some of the executive orders that were coming down, guidelines, which, call them guidelines, but if you violate anything within that guideline, is it really more of a regulation or is it a guideline? And how does an operator interpret that? So take us through kind of your experience on that regulatory oversight disruption. How did you manage it, and what worked for you, or maybe what didn't?
Long-term considerations too.
Yeah, and the long-term considerations of that.
Wow, I don't think we have a few hours it would take to really get through this, but the first thing that came to mind is it's a little bit trying to, at the start, because, you know, we're lucky, we're just in Oregon and Montana, but still in Oregon and Montana, we're in multiple counties, right? And those multiple, you know, health authorities had interpreted things differently, and different states interpreted things. We're only in 2 states. All of our peers out there that were in many states, herding cats is kind of a metaphor that comes to mind. But it was really, we saw inconsistency in our operations, and trying to stay on top of that and manage that and give direction to the teams on the ground, which their number one objective that we gave them carte blanche to do was keep people safe, right? And some people took that really seriously, and some people were in counties where the regulations were interpreted very, very strictly. And so we saw we saw some communities in some areas that didn't lose any occupancy at all, it actually gained occupancy. We saw others that shut down and lost. I think our greatest one, we lost 12% occupancy in one community. And, you know, one was due to an outbreak, but the other is due to the regulations that happened in that county, because it was a very intense COVID county. And so really what it came down to is one of kind of the things that we learned coming out of this was how important communication was, and how important our dialogue and our partnership with, you know, the regulators and the politicians were. And I think it's one of the takeaways that we're all going to have to get more involved in, particularly, you know, on the community-based care side of it. I think the skilled nursing does a really good job. Mark Parkinson and others, and David, and do a really good job. And I know we're working on community-based care too, and we're represented. But I think we're going to have to get to make sure that we can continue to tell our story very well, because it is a partnership. And I think the inconsistency across the board for regulation was really, really challenging to manage. And we've got to fix that now. And to fix that now, we're going to have to tell the story, and we're going to have to involve public-private partnerships.
That's great. Really great points, Fee. And great timing. We did great today. So with that, it looks like we have run out of time. So Fee, Stubblefield, cannot thank you enough. This has been really great having you on our panel today. Thank you for the insights, and I think everybody is going to take something away from this that we've learned from you today. And to my colleague Maria, and from Brandywine, and on behalf of my organization, Ocean Healthcare, we were thrilled to be able to do this today. Thank you to Nick, and Chuck. Thank you so much. Take us from here.
Yeah, Chuck, we need more time next time.
I hear you, and I'll second all of Joe's thanks. Many thanks to Maria, Joe, and Fee for your insightful perspectives on these emerging and evolving trends. As a few seats are available for the follow-up group discussion to today's leadership huddle, if you're able to join us, you're welcome to click on the Zoom link, which is now posted in this webinar's chat. The Zoom session for the group discussion will begin shortly at 2:50 Eastern and will conclude by 3:30 Eastern. We welcome everyone to join us again in 3 weeks from today on Wednesday, June 16 at 2 p.m. Eastern, 11 a.m. Pacific for our next NIC Leadership Huddle, Pandemic 2020, Changing How Debt and Equity Partners Look at Financial Performance. The upcoming webinar will feature a candid discussion with 3 capital providers who will explore how COVID may impact the structuring of capital on a go-forward basis. We also hope that you can join us for the in-person 2021 NIC Fall Conference taking place November 1 through 3 at the Houston Marriott Marquis. Registration opens just next week. You can sign up for email notifications by going to our website at nic.org/fall2021. On behalf of the National Investment Center for Seniors Housing and Care, thank you again to Yardi for sponsoring today's Leadership Huddle. It's through sponsors such as Yardi that, in large part, Nick can provide a forum for education and discussion such as this, and thereby help to enhance transparency, facilitate the efficient flow of capital in seniors housing and skilled nursing, and support access and choice for older adults. With that, we wish everyone a good afternoon. Thank you for having joined us. This concludes the webinar portion of today's Leadership Huddle.
Thank you.
Thank you.